this life no balance.
If there's one thing for certain and two things for sure, this life
Conversation
no balance.
over. Now, what's the connection between balance and sound? Especially your own ability to hear sound or make sound.
Yes.
Audiologist Mercy Karanja is our guest, and she will take us through this morning. Good morning, Mercy.
Good morning.
Karibu sana.
That is quite funny, yes. Life sometimes has no balance. And of course, we're going to dig into it, why it doesn't have any balance.
Yeah.
But of course, something that people need to know is that our ear is not just for hearing. You know, that is the misconception. Our ear is one of the main balance organ in our body. You know, it's the one that works to give us where we are in space, the ear. We say it's the inner ear. So that's what everybody needs to know. So that's why we're here, just to diverge on what is going on with the ear and what are other balance systems we need to look out for. Yes.
Mambo ya masikio.
Mambo ya masikio.
Unajua saa zile sina pesa sisikii poa.
Nikikaa sana sijakula nasikia njaa. Many things.
Unasikia sijui aje.
You know? But to welcome you to the conversation, Mercy.
Thank you.
Phalaris is going to give you the day's quotes. Listen to the quote, listen to the words, and give us your own feeling of unasikiaje.
Exactly.
All right.
Well, today's quote is actually an African proverb and says, "Until the lion learns to write, every story will glorify the hunter." Unasikiaje hiyo quote?
Hiyo ni kama inatuambia the lion who we think is a superpower, you know, a super animal with all the strength, until it runs where?
Until they learn how to write their story. Until the lion...
Yes. Everybody else is going to glorify what they've known, the story behind, you know, and not actually what actually it is. So I think mostly it's a misconception of what we think when somebody is in the superior power like a lion, until they write their own story and see the views of how other people see them. That's the only time the truth can come out. Are they really a lion? You know? So, yeah.
Okay.
I love it.
We start with the basics. What is an audiologist?
Very good, because this not everybody knows who is an audiologist until they get to see one. An audiologist is somebody who just deals with the ear, hearing, and balance, okay? We are part of a small cohort, but sometimes we like associating ourselves with the ENT, who deals with the ear, nose, and throat. But then we subdivide ourselves back only to the ear. Why? It's such a complex and a wide part of how our body works. So an audiologist, we deal with ear, hearing, and balance.
Okay.
Yes.
Now, how do those three things interplay? You remember, I think from, class something knowledge, that, the ear is essential for balance. There's some fluids in there. I don't know if they do this, they do that. But how do these things interplay? The ear, hearing, and balance.
Now, of course, when it comes to how the ear works, the ear, let's go back basic, like the way you have said. The ear usually has three parts. It has the outer ear that receives the sound, and then it has the middle ear that now has the three bones, the ones that you're talking about. And then it has the inner ear, we call it our organ of hearing. We call it the cochlea in just the science term. And that's the part that hears. And then just next to it, it has the balance system. We call it the vestibule system, okay? So that part of the whole ear, starting from the outer ear going directly into the inner ear, where we call it the vestibule system, is where the mechanism of balance and hearing comes in. And then all that interpretation is sent to the brain, okay? So the brain is also part of our balance system. And then that interpretation is sent to our eyes to be able to tell you where you are in space, to focus. You see, like the way you're looking at me? Imagine if it means that your eye is not able to focus. And why? It means the signal that has been sent by your inner ear. So think about your inner ear as the GPS of your body, okay? It's the one that tells you where you are in space, when you turn right, when you turn left, when you stand up, So if there's any problem going with what your ear is telling you, or how it's interpreting sound, or how it's interpreting even where you're in space, then you're going to be off balance, okay? We're going to get into that, but that's how it works. From the ear, going to the inner ear, going to the brain, going back to our eyes. All right? It's a whole communication
It's all
system.
interconnected.
It's a loop.
I'm actually even wondering if our muscles and joints contribute to any of that entire ecosystem.
Yes. As I told you, it's more over a connection. So your brain also will connect with your muscles and in your spine. So we usually say even there are 3 organs that are usually control your balance. One, of course, your inner ear that tells you, we've said it's a GPS. Talks to your brain, and tells this is where we are in space.
Yeah.
Communicates to your eyes, this is how you need to keep focus. And of course, because your muscles and your spine needs to, maybe for you to be upright, to hold like the way we are seated, that's the part of our muscles. And if that communication doesn't come from the brain, then we won't be able to do anything. So it's the spine or the muscles, we call it the musculoskeletal, but it's the muscles, the spine, the brain, and the inner ear, which is the GPS.
But you don't need to hear, do you, Mercy, for you to have balance?
You don't need to hear, because we've said the balance, how many parts? The inner ear has how many parts? 2 ears. The part of hearing and the part of balance. They're interconnected. So sometimes, yes, if you're not hearing as good as you should be hearing, and the part of the inner ear is affected because they're like conjoined twins, you might have some issues with balance. But then you're going to go ahead and ask me, why do the people who are hard of hearing or the deaf have balance? It's most probably the inner ear, which is their balance system, is not affected. Some conjoined twins, one can be really doing well, and the other one is not doing well. So if we think in a more of a layman term, that's the thing. The balance system, though it's conjoined with the hearing system, sometimes they cannot really be affected. But sometimes, yes, if you have a hearing loss, you are more likely, or 3 times likely, to have balance issues.
Okay. Now, also, you don't need to see to have balance.
Yes, you don't need to see to have balance, but then you're not going to know where you are in space. And that's why if you're blind, then you have to have a guide, a cane, or you have to be guided. And sometimes the brain, not even sometimes, it's all the time, the brain is such a complex organ that it's going to simulate things that you are not able to do. Another part of the brain is going to take the part of the eyes for you to feel that I am in this kind of space, okay? Though you're not be able to focus. So that's why even the blind, of course, they're not able to see, but sometimes they can remain really steady, but then they have to be guided. Remember, we said the eyes is for keeping focus so that you don't see things are moving.
Because I'm just threading that. So you don't need to hear to lose balance. You don't need to see to lose balance necessarily. And the other thing is, you may be hearing, but on the balance side, you're not well, right?
Yes.
So si kila mtu anasikia ambaye automatically akona balance.
Apana. And why? Is because lack of balance, or when your balance system is affected, there's so many things that can affect it, other than you not seeing, other than you not hearing, okay? I usually like to categorize it maybe in 3. There's part, of course, what we have just mentioned, a part of the inner ear issues. If you have inner ear issues where I'm more specialized in, then you might have balance issues. But sometimes you can have dizziness or imbalance because of medical conditions. The medical condition can be either, hypertension, diabetes, something going on with your brain, probably a tumor, a stroke, some medical condition that can actually make you feel off balance or give you some dizziness. And then there's this, which is very common but quite underrated. If you're stressed, okay, if you don't have money. Of course, psychological issues need to be taken seriously. But yes, some people do feel quite dizzy or quite not balanced when they are going through some psychological issues, overly stressed, anxiety, panic attack, depression. Those are one of the things that are going to tell you like, oh, I need to have checked. But let me just go into like when we're talking about, dizziness and balance, what are we actually talking about? So that even our viewers can be able to pinpoint, do I actually feel dizzy? Okay. So when we say about dizziness is like a general term to describe many sensations. Okay. And one of the sensations that people are going to say they feel is lightheaded. And others are going to feel like, they're walking on clouds. Others are going to say that it's almost like the room is spinning, or the bed, anytime they turn to the bed, it's like their bed wants to throw them out. Others are going to talk about feeling unsteady, just feeling like when you stand up and you walk, like you need to support yourself. Others are going to describe it almost like a fainting sensation. So there's so many things that describe dizziness, and I usually say that all of us have felt dizzy at one time, because like lightheadedness, if you stand up from a sitting position, you've been seated here for like an hour or so, and maybe probably you didn't have some tea when you're coming, you might feel like, what is that? So that's a kind of dizziness. And some people will feel dizziness when, maybe you have exerted yourself a lot, you're from the gym, you're from a jog, there are times where dizziness you're going to feel one day or another. I don't think there's anybody who just goes through a whole week without feeling dizzy. But then, which dizziness is a concern? If we're saying it's very common, okay? So when we're talking about which dizziness you should be concerned about and think like, this is not actually normal, I know, like, I feel like lightheadedness when I gym, but then this is just off the charts.
This is off,
now, it's when it's accompanied by something, okay? It's not just a lightheadedness, but there's another symptom on it. You're feeling nausea, okay? That you'll be like, okay? If it's recurrent, you feel it today, you feel it tomorrow, you feel it the next day. If you feel it more than twice, then definitely you need to get assessed. You need to have yourself, ask yourself, this dizziness is not normal. Because most people usually rest their dizziness. You feel dizzy and you're like,
let me lie down.
Yeah, I'm very sure that's what many people do. You feel dizzy and, you're like, today I was feeling a bit under the weather, but what you did, you just rested. And then probably tomorrow you're going to be okay. But then if it repeats itself, you shouldn't rest again. You should definitely get assessed. So that's, describing dizziness. A lot of lightheadedness, spinning sensation, unsteadiness, feeling like somebody's pushing you, and definitely feeling like you want to faint. That is what we describe as dizziness.
And that's not normal.
And you said accompanied by nausea, by something else. What are these other something else's?
Now, something else, let's first talk about things that we really need to be concerned about. Red flags, okay? People like looking at red flags about everything, but there are serious red flags that needs to be looked into when it comes to dizziness. One of the red flags is if dizziness comes with severe headache. All right? You haven't been having headaches for a long time, and then dizziness comes and you have this just one of the worst headaches that you've ever experienced in a very long time. Then that is a medical emergency you need to go to be checked, okay, immediately, okay? If dizziness is coming with slurred speech, one moment you're talking, you feel dizzy, and you start slurring, speak, slowly, your tongue it's heavy, then definitely that is another red flag. Another red flag is weakness on any side. Mostly on your left, but we say if dizziness comes with weakness, you're not able to lift your hand, then another red flag. If dizziness comes with sudden hearing loss, then you need to rush to the hospital. Why? These are things that can mimic more than what is presenting, okay? And what I usually say is dizziness is not a diagnosis by itself. It's not a disease, but it's a way of your body telling you something is off. So it will never come by itself. And if it comes by itself, then that's okay. But then if it comes with, a red flag, then definitely an emergency, immediately. But if it doesn't come with a red flag, and then it repeats itself tomorrow, the next day, then you shouldn't trust it. Then you definitely need to plan for an assessment to be done. Okay? So that's what we usually say. Dizziness has to be assessed. Which kind of dizziness is it? Yeah.
Are we looking at dizziness as being one? So it could either be an isolated condition or it could be a symptom of a bigger problem. Like you did mention hypertension, there's diabetes. I want us to look at both scenarios because we keep hearing terms like vertigo come up, which is an imbalance by itself.
Yeah.
We keep hearing other things that could be dealt with alone. But then again, there's the underlying issues. So maybe let's look at both sides.
Yeah. So most of the time when we talk about dizziness, as we said, there are three categories, okay? That one that deals with the ear, where I'm specialized in, all right? So when it comes to deal with the ear, things like vertigo, which actually means that the room is actually spinning, you know? Things tend to move. Your eyes are not able to keep focus. That's what we call vertigo. And it's usually to do with our inner ear because we said it's the GPS. It usually means mostly that the inner ear balance system is not functioning at its optimum. And why sometimes that happens is because the inner ear usually has some tiny little crystals that usually are supposed to guide us on where to look, you know, right, left, up, down, okay? And sometimes they dislodge from where they're supposed to be. So you can imagine like a GPS just losing signal, okay? So the moment you turn your on your right or in your left, your brain gets a mismatch of a signal. It's like we are not on that side. Okay, and it tries to correct that by moving your eyes into a correct form, and that's the time you get, you know, feeling like things are moving, what we call vertigo. So that is to do with the inner ear, okay, because it's the GPS. But then we can find that there's some other dizziness that comes because of medical conditions. We've said like if you have high blood pressure, you're more likely to feel dizzy. And why is sometimes dizziness is more common in the older adults. I don't know whether that makes sense.
Age group gani?
That's a new term.
That's a new one.
Middle older adults.
Middle older. What ages are we looking at?
Older, middle, hey, okay.
So you can imagine, okay, when I'm thinking about it, middle older is, of course, probably from 40, okay? And the older adults are actually from 60. And why it's very common at that age is because that's where our lifestyle condition starts, our lifestyle diseases. That's where our blood pressure starts picking up. That's the time our, diabetes, that's the time, our body just starts deteriorating. We might say life begins there, but even the diseases begin there. So that's why we say dizziness, it's most commonly at around, middle, older adults. At 60, of course, because the degeneration of the body, you're getting older. So even your body systems are also getting older, okay? So what happens when it comes to dizziness is that sometimes it can come with other conditions, okay, which can also combine with the ear, all right? So you might have high blood pressure or low blood pressure, which can actually cause some dizziness. You're going to feel the room spinning because your blood pressure is low. But then if that is ruled out and maybe probably you are still okay, you're still not feeling okay, then you're going to be referred to check that balance system. Was it affected when your low blood pressure went, when it went down? So you'll find is more of a multidisciplinary thing that you can't rule out one without thinking the other one is not affected. So you'll find we keep on cross-referring, and we keep on asking you, are you hypertensive? Are you diabetic? Is there any other condition you have? Why we just want to pinpoint, is it only to do with the inner ear, or is there any other? Something else ongoing.
The body is, it's a network. It's such a complicated network.
Yes.
But when you think about some of these conditions, you mentioned, vertigo, just as we go into a break, when you've given us the red flags, but when is it time to immediately see an audiologist or an ENT?
Very good. So we usually say the moment it becomes a concern, and a concern is, of course, first, red flags immediately that day, within the next hour, you should be in the emergency room. But then if it's the other kind of dizziness where you want to observe, there's no red flag, but it's coming with a bit of nausea, it's lasting maybe a minute or so, and you're like, oh, probably I want to see whether it's stress, But if it's recurrent, it happens next day, then definitely you need to plan for an assessment. Of course, if it's also come maybe with a flu, because many people will find, you'll have dizziness with a flu, then dizziness sometimes you say it can be self-resolving, but then it can change your quality of life. Imagine right now, if you're just seated here and the moment you turn to look at me, you find like, it affects people's quality of life. Yeah. It affects their confidence because you're not able to walk. The moment it starts affecting your day-to-day activities, then that's the time to make a plan to have the audiologist or the ENT check up on you. So most of the things when people come and they say that, I've been feeling dizzy, we usually ask them, the first question is, when was the first time? Because we want to see how long has this person been tolerating this dizziness, Yeah. And you'll find very few people will say it yesterday or 2 days ago. They'll always be like 6 months, 1 year ago, and you're like, why were you living with it,
We struck a balance.
Me and the dizziness.
Yes, they find it so common and it affects their day-to-day life, but they tend to embrace the dizziness, which is just wrong, because you'll find others are going to come when there's almost some, probably they have fallen, they have fractured their hip, they have, there's something worse that has happened because of tolerating dizziness.
Correct. So let's put a pin on that, Mercy.
Yeah.
We take a quick break. We come back. We need to understand all what you're explaining. Also, the kind of assessment that you're saying, kuja to assess. What is assessment? And you're saying it's in the inner ear.
It's in the inner ear.
Yeah.
Yes.
Do they tell you, close your eyes, stand on one leg, jump? I don't know what that assessment looks like.
It's
talk about
28
that.
minutes after 7. Mercy Karanja is an audiologist. We're talking about balance disorders, the causes of dizziness, and when it should be a point of concern for you. We'll be back shortly.
Yeah.
It's all about balance.
You have to balance everything.
Jacalonda is asking, what about losing balance when crossing bridges or difficulty balancing on one leg? People who have height fear of heights. Is that part of this?
Is it?
Or is it a symptom? Is it an indicator that there's something not...
Of course, those are fears that, probably it's another docket that we need to get into. But what I usually say, if you have to hold yourself onto something for you to be able to walk, then your balance system is struggling.
Correct.
Okay? Wherever you are. If you have to hold yourself to walk, or maybe you stand and you want to walk and you stumble a bit, then that is a balance struggling. The fear of it, probably anxiety. Of course, if your body feels like it's not stable, it might cause a bit of anxiety, which you might think you have a phobia. That needs to be looked into. But of course, then we need to do the assessment, okay, that we said we're going to talk about, all right? But yes, to answer, they are fears, but then you need to differentiate fears and struggling to actually keep balance. Yeah.
I'm curious about the gaps. Sorry, Miriam. On when it comes to diagnosis, but we can come to that.
No, I was just going to ask what she's saying. Like, literally, let's put yourself on a bridge. How do you know? I'm holding on to the edge because I'm scared, or because my balance is off. How do you?
And you feel like,
you
because people look down and they're like, I feel like I'm losing balance. I'm gonna fall. I'm feeling dizzy.
Before you got to the bridge, were you feeling like that?
Okay.
Maybe
Because
there was fear.
Maybe there was fear.
Maybe.
Or maybe I had some slight imbalance.
Exactly.
I just didn't know it. Up until I got up there.
and the imbalance plus the anxiety plus the fear you're going to fall.
All amplified.
Yes. Why? It's because balance issues comes with anxiety. Your body will always try to protect you or, make you have that fear. It's fright or fight. And if you get there to the bridge and you are actually not able even to stand, I see when I'm looking at the clips when people are walking through maybe the glass bridges, a very tall bridge, and others actually crumble down. They're not even able to hold on because of the fear. Then it just means that you are struggling, okay? And the moment you leave that bridge, then you should come and have your balance checked. Why? It needs to be rolled out. Is your body giving you a signal? Because we said that dizziness and imbalance is a signal that things are not okay. Yeah.
Go ahead, Fela.
I mean, it's mambo ya balance ni mengi, but I'm just here thinking, like how people are given a diagnosis, or you tell people, hey, maybe I have nikona ugonjwa sukari, I've been diagnosed with anxiety, and people tell you hizo ni shida za matajiri. But these are things that are affecting all of us, and I want us to look at proper diagnosis, especially within the Kenyan context, and what gaps there are, because there are gaps. I mean, there's people who you'll go to a specialist, very few will be able to go to a specialist. Enough of them will go to a GP. A GP will tell you, yeah, hapa labda uko na endo upimwe hii na hii na hii, and then they'll probably tell you to rest, lie down, kula vizuri, kunywa maji, that's it, kunywa brufen, and we quickly move on. But we need, from what I'm hearing, is we need a proper diagnosis to really understand, is it an underlying condition, or is it like a proper inner ear disorder? From your practice, what are the gaps we're looking at when it comes to the diagnosis of these conditions?
Of course, when you talk about the gaps, it comes with lack of awareness, and the awareness comes from, the general public, even the physicians, not actually pinpointing where exactly the problem is. But that's why we are here, just to create this awareness. Like, if these symptoms appear, if you are struggling and you have a spinning sensation, you feel like falling, and it's something that has been happening, then definitely you need to get assessed. And when we say get assessed, is that you need to visit your ENT or audiologist. And what actually happens once you visit the ENT, they are going to assess your systems. They are going to, first we're going to take, like when you come to me, I work at Nairobi ENT clinic, I'm going to take a very structured history, so that I can be able to get to know what exactly are we dealing with, okay? We're going to check your ears and, look into your ears, find out whether your outer ear is okay, middle ear, is it functioning okay? And then we now do a balance assessment. Okay. Now, a balance assessment comes where we want to see that inner part of the ear. Is it mismatching the information that is giving to the brain? Okay. So it's an investigation like any other investigation that you go through. We call it a vestibular nystagmography, but a VNG, but that's why I don't want to be so scientific. That's why we're calling it a balance assessment. Okay. But when you come, you'll find vestibular assessment, you'll find very big words. But what we want to find out, is it the inner ear? Is it the brain? Because how we usually get to know is by actually putting you into an investigation after you've given, of course, us the history. Now, when we're taking the history, you might, we'll ask you so many questions. When it started, and, is there any other condition? Is there anything else, symptom? Are you feeling nausea? Yes. Do you have a weakness? So that we can know, are we only dealing with the ear? Or is there any other medical condition that is ongoing? Because it can be a whole bottled up things that are ongoing, all right? And then after that, we are able to find a management, or we are able to find treatment. And when it comes to dizziness, what I usually want to say is that dizziness actually is very manageable. It has treatment. You don't have to live feeling dizzy and, just resting it up. And you should be able to know when to seek intervention and not let it affect your quality of life. Why? These are the simple things that when it comes to management, we'll find out, is it medical management? Is it some exercise that you need? Dizziness is so easy to treat. Okay. So is it some exercise that you need, that we're going to talk about that? Do you need to be referred to be seen by a physician or a medical practitioner? Yes. Because probably you're hypertensive, you're diabetic, there's something else ongoing that is, to a neurologist. Is there anything else ongoing more than or combined with the dizziness? So what we usually want to say is you definitely have to take the first step to be seen by the ENT or by the audiologist if you're experiencing those symptoms more than 2 times.
Okay. I'll just go into the cost. When Fela is like, watu wanasema hiyo ni ugonjwa wa dosi. Sasa, are you covered under SHA? Yeah. That's genuinely. And how much would it cost to see you, or to just go through this process of diagnosing. Is it my inner ear? Is it something underlying? Is it this and that?
Now, of course, we can imagine audiologists are all over the countries. Okay, we have in Kenyatta, we have in Nairobi Hospital, Nairobi ENT, we have in other even counties. All right. So when it comes to coverage and cost, it depends where you are. Okay, it depends which physicians do you want to see and whether they accept the insurance or not. Okay, so when it comes to matters of cost, it usually depends, of course, where have you gone. So it's usually not over-exceedingly expensive more than any other consultation when you go to see your general ENT or physician, or when you go to Kenyatta or Nairobi Hospital. It depends which doctors do you go to see.
Like
so when it comes to cost, haijalishi. Like, and yes, some institutions actually accept SHA. Okay. I wouldn't go more into it because then finance is going to call me and say, actually, we are taking SHA, we are not taking. But yes, it's acceptable, okay, in many institutions where audiologists are there. If the institution accepts SHA, then even the procedure will be covered under SHA. So first you have to find out, does the institution accept SHA for you to have a consultation done? Because even with insurance, still, if you are to do any investigation, then you have to pre-authorize and ask the insurance, are you going to cover this?
I'll come back to that question because I feel that we still haven't answered it. But then let's start with, how long have you been an audiologist?
I've been an audiologist for a decade now.
Okay.
Is it more than a decade? Yes.
Slightly more than a decade.
Slightly more than a decade.
From your experience, and just in your experience, how prevalent is imbalance in Kenya?
Now, we usually say that the prevalence is more than 50% of the Kenyan. Okay, Kenyans, we don't take data as much, but just for the people who present, let's say even in our clinic, we'll find that 20% of people who present in our facility are going to actually be complaining about being dizzy. And you can imagine we're saying this is something that the public is not aware of. So I'm very sure that it can be a bigger number. Globally, they say 60%. Okay. So, and because they look
60%
globally
of the population has what? Occasional dizziness?
No, dizziness that is actually affecting their quality of life.
Whoa.
We are not talking about occasional dizziness where you are dehydrated. We are not talking about dizziness where maybe vertigo that can be treated. We are talking about disabling dizziness.
60% of the global population.
That's crazy.
And saying so that if we were to bring it back to Kenya, so let's just say more than 50% of the Kenyan population
have some type of dizziness.
Yes. That's affecting their quality of life.
That's affecting the quality
and
of life.
And many of them don't know it.
And many of them don't know it.
Okay.
Yes.
Now, does our health system know that?
Now, that's a bit of a tricky question because part of our health system should be knowing that. And something gets to be known when an awareness is created and this concern is actually addressed, okay? Which I don't think has been done over many years. As you can imagine, people are going to ask, audiologists, what do audiologists deal with? Meaning already,
you don't know.
You don't know, okay? Meaning even getting deeper, what we deal with probably is an issue. The other time we're just having the World Hearing Day in March, and we found out that, just creating awareness to know that audiologists actually exist to deal with the ear, and you shouldn't go over the counter. We find that is quite an untouched medical condition. Even when it comes to hearing aid, which audiologists deal with, we find that, it still have a lot of stigma because people are not aware of this condition that affect their quality of life. And you'll find that Kenyans always, let's say just generally, people are going to want to live and cope with not hearing. They're going to cope with without balance. People will tend to walk with a walking stick instead of coming for an assessment. So you'll find people, the older from 60, they will have the walking cane and they will, nowadays I'm not as balanced as I used to be.
Yeah, it's age.
It's age. They will blame it on age. But did you have your balance checked? Okay, so you'll find that lack of awareness are making so many people live their day-to-day life being affected by something that can be treated because of lack of awareness.
Okay.
So to answer you, we haven't done much about it. It's something that we need to create platforms to, create awareness, to make sure that, the public knows, the government knows, the insurance knows, everybody knows about the function of the ear, and when it comes to, dizziness, and when it comes to balance, and what should be done if it's affecting your quality of life. Yes.
Then the other one is, let's look at the professionals in the space. So you have the ENT doctors with the various specialties and super specialties, and then we have audiologists as well.
Yeah.
Do we have sufficient numbers? What's the number of ENT doctors that we have in this country? And if you know, like on average, and then how many audiologists do we have? And the second bit of that, as you respond, is where do we train audiologists?
Good. Now, one of the ENTs I won't be able to answer because that is not my docket, okay? But they are sufficient. That's what I can tell you, because there's no hospital or county hospital or level 4 that doesn't have an ENT specialist, okay? So ENT covered, all right? Now, let's go back to audiologists. Audiologists, we are just over 100. Okay.
Over 100?
No.
100, the end.
The end. Okay, just over.
In the entire country?
Over, yes. Just slightly over, okay? If I'm wrong, then we are not 200.
And how many of these are in Nairobi?
Now, of course, you can imagine when it comes to the audiology courses and where to learn audiology, it was a specialty where first you have had, you must have had a medical course, whether you are a clinical officer or a nurse, and then you go specialized on it. And then now you specialize on the ear, and the only university that used to offer that was University of Nairobi, okay? That's a decade ago when we studied, okay?
Then it was a degree.
Yeah. Yes. Now, just recently, 2 years ago, a year ago, they're on the first year, they started a degree. KU has also started audiology, so now we have 2 universities offering that. And also KMTC is offering higher diploma in audiology, especially to clinical officers. So the numbers in the next 10 years are looking brighter, okay? So, of course, I think that's where the government came in and find out, there is a need for us to have all audiologists in the counties, back in the levels, in the level 5, some level 4s. And they are trying to now, bring in people like come specialize in this because there is a need. So now we are in that place where we are expanding. Yes.
Okay. So KMTC is offering higher national diplomas, but you must have a basic course first.
Yes.
Either a nurse or a clinical officer.
No, you have to definitely be a clinical officer first at KMTC to do audiology. And then in University of Nairobi, you're taking it as a bachelor's course, so you have to start from your O levels. And also KU, I think.
And KU as well.
Yes.
All right. I was going to ask how you got into the field. Will you decide aje masikio ndio yangu?
I'm passionate about the ear.
I'm passionate about the ears.
That's a good one because I get that question every once in a while, and I worked. My initial course was nursing. Okay, I did my nursing, and then I went to work to an ENT clinic. And when I was working at the ENT clinic, of course, we saw the need of a lot of ear problems because ENT ear, so a lot of ear problems, and we were just like, there's a need here. Okay. And that time there was opportunity to go back to school, and I was thinking, do I upgrade my nursing? Do I fly out? And I was like, let me upgrade. Let me do audiology. Okay. And of course, I had my mentor who was like, Masi, go do audiology. There is space there. And that's how I found myself doing audiology. And it's because audiology is a place where you solve a lot by understanding a lot. As you can notice, I'm a very talkative person, and I found I fitted there because I really needed to solve things in an understanding part of way.
Yeah.
Okay, so that's how I found myself doing audiology and something called hearing therapy. Because as we've said, when it comes to this, is a matter of creating awareness, a matter of understanding. It comes a lot with stigma, without, anytime your body is not functioning, you kind of feel like you are withdrawn from the rest. So it comes a lot with stigma. So a lot of therapy is usually involved. So it's a space where we need a lot of people who want to solve things that people feel like they could live with it or cope with it. And necessarily they shouldn't.
They shouldn't.
They shouldn't.
Before you just get out of it. So at primary care level, if I felt some level of imbalance, can I go to my local dispensary or health center and get assessed? Or will I have to be referred to a level 4?
Now, what usually happens first, you just have to be assessed from there, okay? Because your general physician is going to be able to know whether they need to cross-refer you. Why? Some dizziness, like one of the most common reason people usually feel dizzy is vertigo. And vertigo is where we said some small crystal-like substance come from your inner ear and, it dislodges and causes some imbalance. That can be treated at any level.
With a slap.
Yes. Not with a slap.
Just reset the ear.
They can reset. They can recalibrate. We usually say it usually requires some maneuvers, okay, just to align you back to your steadiness.
Okay.
And that can be done
at a local health center
by a person who is aware that what they're dealing with. You'll find even a clinic officer there will be like, I'm dealing with vertigo. This is what I should do. And and the person will go home feeling much better.
Okay.
So dizziness can be dealt at any level, but it needs to be escalated if it's not resolving. Okay? You don't need to live with it.
Okay.
So basically at that level, it's free. Primary health level, you go.
Primary health level is free.
You go
under SHA,
right?
Yes.
So I answer your question. SHA covers it.
It's sorted.
Yes, sorted.
Now, if you're referred to a level 4 and you have to see now an ENT specialist or an audiologist,
yes,
is that widely available in all public level 4 facilities?
Not really, because you'll find that the audiologist may probably to do the assessment there is not available, and probably they'll be either in level 5 or in the private sector or
level 6.
level 6 or in a specialized facility. Remember, we said these are investigations that need to be done just to find out what is going on. And it's quite, although not invasive, it's quite a complex investigation. And those machines to investigate dizziness are only in specific private hospitals or, leveled up hospitals. So, you might, if your local physician is not able to cope and they have to refer,
so you have
either to go to a private facility where they actually have the investigative tools so that they can be able to manage, because it's very important to be able to investigate. You can imagine, like, if you go and you give the symptoms and they're like, I think you have malaria or typhoid.
I think.
And then they go ahead, give you medication for malaria, but they didn't test it. You'll be like, and then you don't get better. Then, of course, you need to go to a lab. So think about the investigation on like a lab where you have to go and be told like, yes, this is where exactly the problem is, and this is how we're going to treat it. And probably you'll need this and this and this. Okay? Yeah.
I think Maureen her question has been answered. Maureen is saying, great conversation. I know a friend who falls down randomly, even on the streets, and now fears going out on her own. Is this related? Can she start therapy? I mean, seeing an audiologist immediately?
Yeah, because the one of the first thing, as we've said, you need to have yourself assessed. Come see an audiologist and ENT, and we'll find out, like, why are you falling? What is going on? Okay, is there any other medical condition? We'll do that investigative, vestibular assessment, and find out how is your inner ear balance system working? How is it communicating with your brain? How is it communicating with your eyes and in your muscles? And then if we find out there's a particular problem, then we go ahead and treat it. If we find that is not really related to that, then what we do do, of course, we are going to cross-refer to the necessary specialist who can be able to tell that. But the initial, yes, they need to actually walk into an audiologist for them to have that assessment to be done.
You know, even as we say goodbye to Daktari, we're just about to get into the next hour. Big conversation there is treatment, diagnosis and treatment in babies, because kids are also, you know, some who could be born with some of these issues, and maybe some bit of a very quick note on that one.
Okay. Now, something that is not common is dizziness in children. Can you imagine?
I kind of get it. The way they run, you can't afford to be dizzy. You can't. You're moving at 10 kph. You can't afford to be dizzy.
It is there, but it's not common. And why? Their inner ear is usually so stable. Can you imagine kids go in merry-go-round and they come out saying, again? You go there once and you'll be like, ooh. You know, before you reset.
Yes.
Okay? So you'll find kids who have balance issues. Probably something has happened. There is a trauma, you know. They fell down with a bike, hit their head, because I think it can make it can cause some issues there. So you'll find dizziness in children is not common, and when it's there, it's a particular thing that has triggered it, not more, and probably, of course, it needs to be assessed. They will go to the pediatrician. For kids, they don't rush fast to the audiologist because it's not common. So we first need to go to the pediatrician and find out, you know, did they fall? What else do we need to manage? Why? Their balance system is usually so stable. Now, when we are aging at around 40 going onwards, our inner ears start degenerating, start weakening. So those crystals that usually give us our GPS start, coming out.
They move.
You'll just do a sudden head movement, they come out, and you are so dizzy for the rest of your days. So you can imagine. There's some people who will swear they will never go to a merry-go-round. And because the moment they go, before they go back to normalcy, it takes a few weeks. Okay? Why? Age.
Okay.
All right? So with
Age
kids,
as a factor.
not so much.
Love it.
Let's end the conversation there. Mercy Karanja is an audiologist. We've been talking about balance disorders, figuring out the connection between, your inner ear, your brain, the rest of your body, everything. Of course, hashtag is Fixing the Nation NTV. When we come back, we'll talk about fast fashion and the antidote to it with Shania Timbwa.